Fractures through the enamel don't usually require acute emergent treatment, but fractures through the dentin or the pulp have to be covered. If you don't cover them, you'll fail to relieve your patient's pain and predispose them to pulp necrosis or abscess. And by covering a dentin fracture, you may prevent a root canal. Remember, the white part of the tooth is the enamel, the underlying dentin is a cream or golden yellow color, and the pulp is pink or reddish. The materials you'll need to take care of acutely fractured teeth include pre-lined calcium hydroxide paste, a stainless steel mixing spatula, a mixing pad, and dental rolls or 2x2 gauze to dry the teeth. Make sure the tooth is dry before applying the calcium hydroxide paste. A supraperiosteal injection will make the procedure more comfortable for your patient. The tooth that we're going to be covering is a central incisor with a fracture through the pulp and the dentin. The dental box contains pre-lined brand calcium hydroxide paste. It comes in 2 distinct tubes. The contents of each tube are mixed together to activate the cement. Place equal amounts of the catalyst and base onto your mixing pad. A small amount of each is usually plenty if you're only covering one tooth. Using the stainless steel mixing spatula, mix the catalyst and the base thoroughly until the mixture begins to thicken. This usually takes about 20 to 40 seconds. When the calcium hydroxide thickens up, scoop it up onto the flat blade of your spatula. Apply it to the fractured surface of the tooth, making sure all of the exposed dentin and pulp are covered. Remember, the tooth must be dry in order for the calcium hydroxide to adhere properly. The moist environment in the mouth will speed up the hardening process of the calcium hydroxide. Have the patient keep their mouth open for 10 or 15 minutes after applying the paste to the tooth. A rolled up gauze roll positioned away from the site of the covered tooth will help the patient keep their mouth open.